The way we all felt so seen when Dr. Vivek Murthy issued a public health advisory on the state of caregiver and parental stress. In case you missed it, word is parenting and caregiving truly has us out here fighting for our mental health and well-being. The Surgeon General just released an advisory about the critical imperative to support caregiver and parental mental health and well-being through shifts and changes in policies, programs, and culture. Parents and caregivers are really going through it. You've already seen the statistic that 33% of parents and caregivers report experiencing stress as compared to 20% of other adults. 48%, that's almost half, of those adults also report that their levels of stress are completely overwhelming. And on top of that, they feel like they're going it alone. 65% of caregivers and guardians report social isolation and loneliness as compared to other adults. Make that 77% if you're a single parent. Now, caregivers are stressing. We're stressing about the physical and virtual health and safety of our kids, demands on their time. They're stressing about the economics of parenting, just a couple of the snapshots. And each one of those stressors and challenges changes and shifts anew across the developmental lifespan. Now, let me go ahead and say this. I have reliable and safe childcare that I can afford. I have access to flexible work arrangements. I have an amazing supportive partner. I have a supportive community. I am even a child and adolescent clinical psychologist and associate professor at Yale School of Medicine, specializing in this very population. Just to give a snapshot of a couple of the privileges. And as a mother of 2 children, the way that the stress can be a 10 out of 10 is unreal. It's not even a debate. And if that's the stress that I experience within the context of all of those privileges, it is absolutely exponential in the absence of those privileges. Now, as a child and adolescent clinical psychologist, very much still navigating the youth mental health crisis, you better believe I skipped right to the back of those pages that talked about the bi-directional nature of youth mental health and caregiver mental health. The totality of caregiving stressors can not only seed, but also exacerbate mental health struggles in caregivers, which in turn has significant negative implications for the mental health of our youth. In fact, some research showed that youth were twice as likely to have a mental or behavioral health disorder when they had a caregiver who reported having poor mental health. Now, the solution to this complex problem is just as multi-layered. It will absolutely require individual level supports. Parents absolutely need to be empowered through policies and practices, but also through some of the different shifts in culture. They need to be able to feel connected, which means being able to talk about and express openly these different challenges that we now know are so clear across all of the data that we see. And at the end of the day, supporting parents as a youth mental health advocate is supporting youth. The two are complexly fused and linked together. So I look forward to the ongoing dialogue that helps us to really conceptualize and think about youth and caregiver mental health as part of an ecosystem and thinking through the different strategies and solutions to support them both.